Hello, Dr. Prakasam again talking about management of diabetes. How do we plan care? We have to follow people with diabetes on a regular basis because diabetes is very dynamic. So it keeps changing as the patient gets older, the child growing up, activities change, emotions change, and the needs change as well. So we have to monitor them several different ways. The commonest one which we all use apart from the blood sugar checks is the hemoglobin A1C, measuring your percentage of hemoglobin which is attached to the glucose molecules. This is done every 3 months because the cells are alive, the red blood cells are alive for 90 days. So the goal is to keep the blood A1C below 7.5% in children and 7% or less in adults without hypoglycemia. Then we have a set of annual labs we do. We check for celiac because the percentage of children or adults who have celiac disease is increased when you have type 1 diabetes. Celiac disease is sensitivity to gluten and you have to avoid gluten in diet. Then you have the thyroid disease called the autoimmune thyroid disease or Hashimoto's thyroiditis, where you have autoimmune antibodies attacking your thyroid gland, where the treatment will be to use thyroid medication. We have to monitor for kidney functions on a consistent basis once a year. Several years of not taking care of your diabetes can result in kidney disease. Early part of the kidney disease is reversible. Later part of kidney disease, you have to go in for dialysis or transplant, so we want to avoid that. So these are all avoidable way of getting into major complications. Then you have to monitor your eyes on a regular basis to look for how the retina is affected with diabetes. With good diabetes care, you should not have any eye problem. You have to look for foot examination on a consistent basis at least once a year because microvascular and macrovascular changes can happen and that can result in foot ulcers and sometimes even with amputation. So teaching the patient with diabetes about good foot care will go a long way in avoiding all of those things. But the most important thing is relearning diabetes as well as your child on a consistent basis. We as caregivers, we have to relearn every so often so that we can provide the best care for the people whom we love. Thank you.